Nursing homes are confused about which pandemic health and safety protocols they should keep following and want to know why the state health department is directing them to follow some newly expired guidance since Gov. Andrew Cuomo abruptly ended the coronavirus state of emergency last week. Nursing home officials have been begging the DOE for clarification on at least 30 executive orders after Cuomo's announcement last Thursday. According to an internal memo detailing the policies in limbo, staffers have been directed to keep following expired June 10 guidance mandating once-a-week testing for unvaccinated staff. Emails obtained by the Post show the current guidance is expired, so does that mean we are no longer accountable for testing until a new guidance is released? One staffer wrote in an email on Monday, June 28. There is no new guidance at this time, responded the DOH's COVID nursing home info general email. But the DOE hastily released a revised order Thursday afternoon permitting nursing homes to follow federal CMS guidance order once-a-month testing for these individuals if the county positivity rate is less than 5%. New York's statewide positivity rate has been below 1% since the beginning of June. Effective immediately, operators and administrators of all nursing homes are required to test or arrange for the routine testing for COVID-19 of all personnel who have not been fully vaccinated, as defined by the Centers for Disease Control and Prevention, including employees, contract staff, medical staff, operators and administrators, for COVID-19 once per month consistent with county positivity rates in the updated April 27, 2021 CMS guidance, QSO 2038-NH, which stated, vaccinated staff do not need to be routinely tested, wrote Sheila McGarvey Thursday, the DOH's director of nursing homes in a memo obtained by the Post. But other issues remain in limbo, including whether or not unlicensed workers, such as certified nursing aides, are still permitted to give COVID-19 tests to residents. Also up in the air is a requirement permitting out-of-state workers to keep posts in New York nursing homes without facing civil or criminal penalties for lacking a New York license, as well as the relaxing of strict visitation requirements such whether or not vaccinated residents and staff still have to adhere to social distancing rules. Roughly 15,000 virus-related deaths have been recorded in nursing homes since the pandemic began, according to the DOE. The New York State Bar Association released a report last month blasting the Cuomo administration for adopting the controversial March 25, 2020 directive that required facilities to admit medically stable COVID-19 patients discharged from hospitals. Their analysis concluded the order increased the overall death toll in elder care facilities. Meanwhile, the U.S. Attorney's Office for the Eastern District of New York is investigating the Cuomo administration's handling of nursing home death data and whether or not officials willingly withheld the true total of virus-related deaths. The Democratic-led state assembly is also probing the matter in a wide-ranging impeachment inquiry into Cuomo, which includes multiple allegations of sexual harassment against the governor and the alleged misuse of state resources tied to his $5.1 million American Crisis book deal. The DOE says no, there's no change in guidance. Of course there's changes. Because the order is over. It's just one more in a long series of horrible communication, seethed Rensselaer County Executive Steve McLaughlin, who has been in communication with the county-run home, the Van Rensselaer Manor Nursing and Rehabilitation